Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please leave your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order. I hope this will be very convenient for the continuous study. My dear friends, in the last class we have been discussing about some of the tips to Ayurveda Komarvritya practice. Komarvritya practice in Ayurveda. When our PG students are going to the community, how they can build the Ayurveda practice and what are the important aspects that we need to consider. So that we have been discussing. So today we will continue the same. Now we need to change the mindset. This is what actually we are discussing. We have to frame ourselves according to the need of the society. The things may not go as per your wish. Okay, things will go as per the wish and demand and challenges of the community. So rightly we have to adopt ourselves. So so many important aspects we have discussed in the last class that what we can do can give more importance for the preventive aspect. We should develop a well child clinic. Then we can prepare our own medications. We have to integrate yoga, pranayama, panchakarma, etc. Then we have to start the online clinics and online counseling, special camps, etc. We have been discussing. Some of the other important points are now certain preparations of the yogas, and you can also go for marketing. Now this is also very important. You can prepare your own yogas. For example, in the childhood practice, we want to prepare some very good yoga for the immunity. You have got your own understanding. You make the combination of some of the drugs and then prepare the yoga. And marketing. In the beginning, you only start with only one preparation, okay? Only one immunity product, maybe immunity booster product, okay? You just market it, okay? Because you are the only one. There is no any other combinations, partners, etc. And in the due course of the time, maybe after 1 year, so you will be earning significantly by simple one yoga. You are marketing one particular product in the market. Of course, marketing techniques will be there that you have to study, and and also some of the legal procedures, etc. is there that you can follow. But whatever may be the case, so you are the whole and soul of that particular product. You are the only owner, and ultimately, whatever the benefit you get, that will be for you only. There is no partners. Okay, so initially you can start with one important yoga, like in yoga for immunity boosting, yoga for intelligence, increasing the intelligence, etc. Or Medyasana yogas you can prefer. Like that, so many other drugs you can, according to your ideas and all, you can prepare. And this is also side by side one. When you are starting your clinic, okay, probably you may have less patients. So in that time, in the meantime, you also start this also. Okay, one yoga is also your marketing. One product also your marketing. So in the due course of the time, after 1 or 2 years, definitely you are earning significant from one single yoga. So this you can practice. There is a lot of scope for such things in Komarvritya pediatrics. Now again, we know that we are not, repeatedly I am telling, we fail to read the pulse of the people. Okay. Now just you go for a yoga for hair fall. See, I can tell number of people, non-medicated, that means non-medical people, okay, or non-Ayurveda people. So those who are launching some of the products, like hair oil for hair fall, okay, memory syrups, immunity syrups, and some of the tela, etc., oil for complexion and all. So I can say number of such examples who are non-medical people, and they are earning money by using Ayurveda. We are being the postgraduates of Ayurveda, we are not able to do anything. So this is totally a failure from our side. So we should look forward. For that we need to change our mentality. Not only clinic, no, come out of that. Next. Regular visit to the kindergartens. This is also another important. You need to, as a doctor, postgraduate doctor, you are a PG doctor now. Okay, so you completed your PG. So now regular visit you have to do to the nearby kindergartens. Okay, LKG, UKG schools and all, and you should have a tie-up with them for immunity booster medication. See, every child is having infection. Every parents are worried about increasing the immunity of the child, how to increase the immunity of the child. Now you should have a tie-up with these schools and regularly visit there and give some immunity booster medications for the prevention of the recurrent respiratory tract infections, etc. And then there will be development of the wrap-up and there will be a development of understanding, and definitely they will be your patients in future, and you can also promote your products. So this is how we have to think being a Ayurveda pediatrics. Now start a play school. This is another idea. If it is possible, those who are interested, little have a business mind and all, so they can also start with a play school, along with your clinic setup. Now parents will always feel very, very safe to leave their kids in your play school because you are itself you are a doctor. So they think that my child is round the clock under the supervision of the doctor. So what parents actually need? So they need this much of facility, okay, assurance and all. They will be very free now. So if possible, you can also start a play school along with your clinic, and so that you can manage all these things. Daycare centers you can start. You can also start the daycare centers. Now, so many parents are there. They have the cerebral palsy patients. Okay, so cerebral palsy child is there, mentally retarded child is there. Okay, and maybe some disabled child will be there in their family or in their home. Now, probably they also have the other kids in the family also. They have to take care of them also. And if both the parents are working mothers, mother and parents, then what happens? This particular CP child and this disabled child is a big burden for them. But they cannot leave that child, isn't it? So that's an emotional issue. So you can start a daycare center for cerebral palsy, daycare center for this DMD like physical disabilities, etc. So 9 o'clock the parents are leaving the child in your clinic setup, and by 8 o'clock or 6 o'clock, 7 o'clock evening they are taking back, and you can charge accordingly, and they will feel very, very safe because they are leaving their kids under the shelter of under the supervision of a doctor. So these are some of the important things that we can do. There are many other things. It's healthy food we can market. We can start marketing the healthy food for the children, healthy annaprasana food. Okay, so many complementary feeding methods, weaning foods, which is coming in the market. In parallel to that, you can also start the Ayurvedic methods of this weaning and weaning food. You can market it. Now, parents are ready to embrace Ayurveda, but we are not ready. Yes, this is a very important thing. We have a favorable situation now, actually. In the present day scenario, really Ayurveda has got a very favorable situation because the maximum parents, they don't want to give other medications because of various things, adverse effects and all those things, and they have some bad experience and all side effect, adverse effects, long-lasting medication they have to take. So somewhere from the inner core of their mind, they have got a feeling that yes, I have taken sufficient amount of the pills. My child should take only Ayurveda, so that there should not be any adverse effects. Okay, so this favorable situation is there now. They are seeking alternate situation, but we are not able to encash it. Now there is no expert Ayurveda physician whom they believe. This is the problem. But if you establish yourself as a successful Ayurveda physician, okay, so then definitely they will come to you one or the other day. You don't need 100 patients per day. You need only 10 patients per day. That is sufficient. Okay, so we can we are ultimately not able to counsel them or convince them that what are the benefits of Ayurveda medicine, why you have to take it, how long you have to take it. Okay, although it is slowly acting, what are the benefits? These things has to be convinced to the patients or parents. Then we have got a very good chance. Now, why can't we start a well-child clinic? This is another important issue. That part we will going to discuss in the next class. This is a very important issue, well-child clinic. Concept of well-child clinic is emerging now, so that we will discuss in the next class. Thank you.